In case of a seizure, especially if the seizure is a convulsive seizure where the whole person is shaking, that requires emergency treatment. The person should be first and foremost shifted to a safe place. That is, if the person is very near to, say, a swimming pool or is near to objects which are likely to fall on him, the person should be shifted away from such danger. Once shifted and once in a safe place, we should try to make the person roll towards what is known as a recovery position. What is a recovery position? Basically, it's a left lateral position. That is, the person should be turned towards his or her left side. That is, the left arm and leg should be on the floor, whereas the right arm and leg should be on top. In case the person is shaking very vigorously and one is unable to turn, that's okay. You can leave the person in the safe space and let the convulsion or the seizure get finished. Most seizures will stop within 2 to 3 minutes without any intervention. In case the seizure continues beyond 5 minutes, then definitely the person needs medical help. In that situation, you should immediately try to call an ambulance or emergency medical services. And if they are not available, you should try to shift the person to the nearest available hospital. In case the person has an emergency rescue plan, it is usually in our country, that is in India, there is a midazolam spray that they may be carrying. It's a medicine spray that can be used to stop seizures. In case of a seizure, there are certain things that one should not do. One should not try to make the person smell noxious objects like footwear or onions, which are very prevalent in our culture. One should also not try to put anything into their mouth, because that can actually be dangerous. One should not try to forcefully open someone's mouth because all those processes can involve inherent danger. Although it is culturally very prevalent in our country to try to really sort of forcefully open the mouth of the person, but this should never be done. In case of a prolonged seizure, that is a seizure more than 5 minutes, the person should be immediately shifted, either through an ambulance or through other ways of transport to a nearby hospital. Thank you.